Greetings, I'm Dr. Max Gomez at the Fifth International Vatican Conference, and I am joined now by Dr. Debra Houry from the CDC. Welcome, Debra.
Thank you. Great to be here.
Thank you. So let's start before we get into some of your specific areas of expertise. Let's talk a little more broadly. I know that you must attend so many different conferences, right? And they tend to be relatively narrowly focused. They focus on a disease, on an issue, on an organ even. What do you think is the value of this kind of really broad-based conference, such as the Vatican Conference?
So I think bringing people from all different stages and types of experiences when it comes to emotional well-being and hearing their personal stories and to learn about the research that's being done in the field really gives it a full perspective on the issue. I sat on a panel with Brandon Marshall and really heard about his lived experience. And I think that helps connect it with the data and the science. And in order to move forward as public health experts, we need to know what's really going on to be able to work to prevent and help communities and individuals. And I think this conference is a great example for messages of hope and resilience and communities coming together.
It's so important. You're exactly right. Thank you. Now, I think early on during the COVID-19 pandemic, people focused on the physical damage that was being done, lungs, heart, some other organs, blood clotting, and so forth. But now we're finally getting to some of the impact on mental health. Talk to me a little bit about how important that aspect has been.
And you're right, the COVID-19 pandemic has had a major effect on our lives. And many of us are facing challenges that can be stressful and overwhelming and cause strong emotions. And you add to that public health actions such as social distancing and physical distancing, which are necessary to reduce the spread of COVID, but they can make us feel isolated and lonely and can increase stress and anxiety. So it's natural to feel stress, anxiety, and worry during this pandemic. But there's ways to buffer that and to really find ways to be connected, even if virtually. It could be ways like connecting via Zoom or a bike ride. I've joined a virtual book club. And I think it's important that we acknowledge the toll that this stress and uncertainty can take on our physical and mental well-being, and to be patient with ourselves and really find other ways to take care of ourselves, like exercise and eating well and getting plenty of sleep and our new routines. And it can also mean taking a break from listening to the news or reading some of the stories, because while it's important to stay informed, sometimes we need time to disconnect throughout the day, just truly making time to unwind and do the activities that you love.
So true, so true. Let me ask you, just because I'm curious from a neuroscience point of view, are we able to tease apart the effect on mental health from the virus itself directly versus the stress and anxiety of lockdowns and fear of getting infected and so forth?
So we're still learning a lot about the virus and how it impacts different body systems and organ systems. And so I think there's still a lot to come on that. Certainly we have seen that it has resulted in some neurologic conditions. Plus, as you said, you add stress and all that goes on with the pandemic, and that can certainly compound that. Some of our surveys that we've done have shown that about 40% of US adults have expressed anxiety or mental health issues or have increased substance use.
So suicide risk and suicide rates, have you seen an impact on that during the pandemic? And I know you mentioned some of the things that could help. What are there any other concrete steps that we can take to try to mitigate that?
Absolutely. And so we have seen an increase in emotional distress and things like suicide ideation and suicide attempts. Suicide deaths for the first 6 months of 2020 that we have data for have not increased. But certainly the emotional distress and the suicide attempts do worry us, particularly with things like economic issues and relationship issues and substance use that people might be experiencing. So there's a few things we can do to really safeguard people from the risk of suicide and support them. I always say ask people, how they're feeling. It will not increase somebody's risk of having suicide and might keep them safer. And then they know that you care. If they do mention that they're thinking about hurting themselves, keep them safe. Make sure they have, if medications or a firearm, that it's locked safely. Be there. just being there for someone really increases connectedness and limits their isolation. Certainly help them connect if you're worried about them, starting with the National Suicide Prevention Lifeline, and then follow up. It's not a one-time thing. If somebody has expressed you anxiety or depression, you need to really follow up and be supportive and have that ongoing contact. And the other thing I would just mention is people think a suicide death is inevitable and not preventable, and it is preventable. And in the ER, I found that most people who attempted suicide were grateful they lived and felt supported by their family and friends. And research says that about 5 to 10% of people who attempt suicide will later die by suicide. So it really is important that we intervene.
Absolutely. And Debra Houry, thank you so much for that. And I'll be really interested to see what the statistics are as we gather more from the second half, because I suspect that some of these stresses and things can be really cumulative. So it'll be interesting to see how that all works out. But thank you for your insight, and especially for your tips on how to keep people safe. We appreciate you.